Bioprosthetic valves derived from porcine and bovine heart tissues are widely used as artificial heart valves in clinical settings. These valves offer significant advantages including reduced need for long-term anticoagulation compared to mechanical valves and improved hemodynamic performance. However, the longevity of bioprosthetic valve is a major concern, with qualification being the predominant cause of their deterioration and eventual failure. Calcification leads to reduced stiffening and reduced functionality of the valve, necessitating reoperation or replacement, which poses considerable risks and challenges for patients. Recent advancements in understanding the mechanism of calcification and strategies to mitigate these issues are crucial for enhancing the durability and performance of bioprosthetic valve.
Several factors contribute to the development of calcification in this bioprosthetic valve. Firstly, we talk about intrinsic factor. These factors inherent to the bioprosthetic valve material and also the structure. A. Tissue type and origin, porcine versus bovine. The type of this tissue can influence calcification. The structural and biochemical differences between this tissue may affect their propensity to calcify. B. Chemical composition in phospholipid. Phospholipid in the valve tissue can bind with the calcium to promote calcification. For the collagen matrix can also contribute to the calcification, particularly if it is poorly cross-linked. Second, we talk about extrinsic factors. These are factors related to the patient and their interaction with the bioprosthetic valve in the body. A. Patient-related factors. Age. Younger patients are at the higher risk for the calcification due to the more active metabolism and also higher level of circulating calcium and phosphorus in the body. For metabolic disorder, conditions like hypercalcemia, hyperphosphatemia, and also chronic kidney disease also will increase the risk of calcification. Hemodynamic factors. We talk about mechanical stress. High level of mechanical stress and shear force on the valve also can promote tissue damage and subsequent calcification. For the last, we talk about biochemical pathway. Several biochemical pathways are implicated in the calcification process. Oxidative stress, which are ROS, reactive oxygen species. Oxidative stress can damage valve tissue, leading to the condition that will lead to the calcification.
For bioprosthetic heart valves, while offering excellent biocompatibility, are prone to calcification, which leads to valving failure. To address this, several biomaterial approaches have been developed. Firstly, tissue fixation techniques are crucial. Traditional glutaraldehyde fixation reduces antigenicity but can promote calcification. By using alternative fixation methods like epoxy compounds or detoxifying aldehyde groups with amino acids, we can reduce calcification sites. Secondly, anti-calcification treatments play a vital role. Ethanol treatment is effective in extracting phospholipids, while detergents can remove cell membranes that initiate calcification. Additionally, incorporating calcium-binding agents like EDTA into the valve material can significantly prevent calcium deposits. Lastly, surface modification techniques are essential for creating a less calcification-prone environment. Coating the valve surface with biocompatible materials such as polyethylene glycol or PET creates a hydrophilic layer that resists protein absorption and cellular adhesion. Moreover, surface modifications with anticoagulants like heparin can reduce thrombus formation, further minimizing calcification risk. By integrating these biomaterial strategies, improved fixation techniques, anti-calcification treatments, and advanced surface modifications, we can enhance the durability and performance of bioprosthetic heart valves, ultimately improving patient outcomes.
I will explain about biological evaluation and risk management of bioprosthetic heart valve according to ISO 10993-1, and for the nature of body contact, which is a circulating blood, which is an implant device, and for the contact type, which is a internal tissue or a blood contact. The contact duration is more than 30, we can call as a permanent contact, And I've selected 5 main testers. The first one is cytotoxicity, which is ISO 10993 -5, and the purpose is to determine the potential of the device to cause cell damage, and it can test throughout the in vitro cytotoxicity test using a cell cultures. And for the sensitization, which is ISO 10993 -10, the purpose is to assess the potential of the device to cause sensitization, which is allergic reaction. And the test, you can test throughout a local lymphatic node assay, which is LLNA, or other tests as well. And for the third one is irritation or intracutaneous reaction, which is ISO 10993 -10. The purpose is to evaluate the potential of the device to cause irritation when in contact with body tissue. It can test throughout intracutaneous injection tests. And the fourth one is systemic toxicity, which is ISO 10993 -11. The purpose is to assay the systemic toxicity after implant. The test, we can test throughout acute systemic toxicity test in a small animal such as mice or rat. And the fifth one is hemocompatibility, which is ISO 10993 -4. The purpose is to assay the interaction of the test device with the blood component. And there are a lot of testers we can use. The main thing is hemolysis test, coagulation test, thrombogeneticity test, and other tests as well. Thank you.
The two main components that have been considered for the bioprosthetic valve are: first, leaflet. It is act as the flaps that the heart opens and closes to regulate blood. The other component is the swing rate. This allows for secure attachment of the valve to the native tissue of the heart. The chemical and mechanical properties that are important to the product must be non-toxic, where all material must be non-toxic and should not discharge any harmful substance into the body. Next, valve should be biocompatible. The materials used must not evoke any immune response to the body. The product also need to be flexible and elastic. The leaflets must be flexible enough to open and close with each heartbeat while maintaining their shape. It is also need to be durable and fatigue resistant. The valve must endure millions of cycles of opening and closing without significant wear or mechanical failure.